Talking about the budget and various parts of it, the various components in here that got money. One of them, of course, and the one that gets talked about a lot, and one of the ones that people said, why do we give people a tax break when we should be investing more in healthcare, for example? Aaron DERFEL, the Gazette's health reporter, who's broken so many stories during COVID and, of course, now taking a look at the system, posted a rather interesting thread yesterday about how the real increase in funding for healthcare and social services is about 1.5%. In other words, well below the rate of inflation. And you look at the global number for healthcare and you're thinking, wait a second, it looks like a giant number. So Aaron, first of all, thanks for being here. Second of all, when you say you take a deep dive, how is this possible? Because I thought the feds just gave the province extra billions of dollars.
Yeah, exactly, Aaron. So what the government is using is perhaps a form of accounting sleight of hand. It's using this accounting term, an arcane accounting term, annualized average growth from 2019 to 2024, which, or rather the 24-25 fiscal year. So that, we haven't reached that point yet. And so it's saying that when you average it out that way, it's 7.7%. That got me to looking at it, and the actual increase, the real increase in spending from last year to this current fiscal year, 23-24, is 1.56%. It doesn't even cover inflation. And then I was looking at the federal transfers, and the Quebec is getting an extra 1.6 billion in federal transfers just for health, but the real increase in health spending is $902 million. So there's a shortfall of $600 million. Where did that go? Did that go to the tax decreases? Your guess is as good as mine.
I'm gobsmacked. I'm trying to make sense of this. And then I think I can hear Christian Dubé, our health minister's voice in my head when he was saying we're going to shake everything to its foundation and that there's going to be a major overhaul. How is that even remotely feasible with these numbers?
Well, they're making these projections. So they're talking about this 5-year, $5.6 billion plan, but they're making these projections into the future, right? Most of this money, there was an announcement, for example, for the Anglophone community which the QCGN applauded, that $31 million is going to Anglophone groups on issues like wellness, and it's just $1 million. Most of that $31 million increase is going to come in 4 or 5 years from now. So this is something that governments sometimes do. I do think that the minister he wants to shake things up. So he's creating something called Santé Quebec. He's spending $20 million this year, projected to spend another $40 million in 24-25. And the goal of that is to make the system more efficient. He told La Presse recently that he wants to hire these top guns from the private sector who will somehow make the system more efficient. Is that wishful thinking? I don't know, but Dubé does come from the private sector, so he's thinking that perhaps these managers could work their magic and make the system more efficient.
Yeah, and what we hear when that story broke, Aaron, I'm sure you heard the same thing. People saying, "Wait a sec! Instead of reaching out to those business types, why don't you ask people on the ground in the institutions what needs to be done?" This seems like we're kind of doing the same thing in a sense where we centralize this. When Gaetan Barrette was still the health minister, got away from it, coming back and going back to where we started from.
Yeah, so there have been so many reforms. It goes back to 1995 when they closed hospitals only to invest in, the construction of 2 new super hospitals, buying out nurses only to hire them back. And then, with the Barrette reform, in 2015, lopping off a layer of middle management and creating these umbrella health organizations called, in French, CISs and CISs, for critics to say that, the system has become more sclerotic, more bureaucratic than ever. There are fundamental problems. And when you just look at it, there are 1 million Quebecers who don't have access to family doctor. You've got a backlog of 170,000 surgeries. You've got 21,000 of those surgeries people have been waiting for more than a year. Okay, you have record wait times to get a spot in a CHLD, a long-term care center. Record wait times to get home care. So, and today I checked Lakeshore General Hospital. I wrote a whole series on that. Their average wait in the ER now is 51 hours and 11 minutes. So these are serious, serious problems. They're not going to be fixed overnight. And increasing spending by, 1.56% when people say, the medical rate of inflation is 5%, it doesn't quite cut it.
I don't even know what to add to that. I'm kind of with you on that when you say you're gobsmacked. You hear the numbers, you hear this now again. So this was addressed weeks ago about ER times. You just finished saying, Aaron, what is the average wait time now at the Lakeshore General?
Well,
ER?
today, at one point, it was 51 hours and 11 minutes.
It's beyond, it's just inexcusable. It's
And
unacceptable.
I asked you the question, Aaron, when we first started talking about this, it's great to say you're throwing money at the situation or at the problem. That's not what people on the ground tell you is necessary to fix things.
It's a combination of things. Yes, you need more accountability. And the minister is going in that direction, so he's posting more stats. There's a dashboard that's available, and you can see what's going on. So he's tracking the situation better. But normally the problem was there before the pandemic, and it's only gotten worse. And it's going to take. It's just a big machine. It's a mountain to move, and you're right about throwing money at the problem. Sometimes when you throw money at the problem, that opens the door to corruption. It opens the door to inefficiency, to waste. So you need to, if you're going to invest money, you need to have benchmarks. You need to be more accountability, and that's part of where what Dubé is doing. But what is he doing? He's creating this other agency called Santé Quebec, with and is going to invest $60 million in that. So. I spoke with an ER doctor who seemed to think it's a good idea. But as someone who's covered healthcare for the past 25 years, I've heard these things over and over and over again. And I have to say, I don't see the situation getting better in the next few years. I see it getting worse because the population is aging. So ERs are stuck with sicker and sicker patients, right? And so there's more and more pressure on the system. It's not just a Quebec problem. We're noticing this in Ontario. We're noticing it in the States, and even in England. They have their cherished National Health Service. So the pressures are worldwide. There's a shortage of staff, and patients are older with more complex medical problems. There's no easy fix to this.
There is no easy fix, Aaron. We're going to have to leave it at that. I thank you so much. We appreciate the time again today.
Thank you.
My pleasure.
Aaron DERFEL of the Montreal Gazette.